Hello, I am going to go over a presentation involving PTSD and health and the resources for veterans and their families. So just to introduce it, some of the symptoms of PTSD include intrusive memories from trauma. This can include flashbacks, things like that. They can also show signs of avoidance. This can be shutting out the family or avoiding going out in public places due to the fear of those flashbacks from war times. Also, negative changes in thinking or mood. This can include anger or lashing out at their family or children, and changes in physical or emotional reactions like impaired coping. Um, Things can include alcohol or drug use and behavioral changes. Some risks associated with PTSD are increase in cardiovascular risk factors, including tobacco use, hypertension, diabetes, and obesity. Oftentimes, those with PTSD are already in a state of hyper awareness. So when you add those factors, like hypertension and tobacco use, that state of hyper awareness is worsened and it just amps them up that much more and can worsen any cardiovascular issues. Also, depression, anxiety, and suicidal thoughts or actions. These factors can actually increase the risk for developing PTSD and can often worsen it. Um, Something else that can worsen it is substance use disorder and lacking a good support system. A veteran may feel even more isolated when they come home to civilian life if they lack a support system. This can be family, friends, or a group that they go out and they attend weekly or something like that. Um, Something else. And I also included the quote, early onset of hypertension, circulatory, digestive, nervous, and musculoskeletal system disease was also documented in young U.S. veterans. This I found in the article that is cited later on. So now getting into family and the veteran, some familial hardships can include families often claim that they feel like their loved one hasn't truly come back, that they return as an empty shell. So imagine trying to approach someone you've known all your life and they don't respond how they used to, that they can present with maybe a flat affect, or they don't look at you or make direct eye contact with you when you're speaking to them. It's just hard seeing someone that you considered to know as someone you no longer feel like you know. Um, Also, dealing with the adopted coping mechanisms of their veteran. So, veterans often, in order to deal with their stressors and calm their nerves, they may take up tobacco or other substance use like alcohol or other drugs, even. And these can possibly be destructive coping mechanisms, and they can take out these coping mechanisms and how the coping affects their behavior. They may take that out on their families, worsening the situation. And in severe cases, the family may even shut out that veteran for a time in response to not being able to handle that veteran's behavior or their behavioral changes. But some veteran and family resources that we can offer or inform them about is a crisis resource. This is where families who are concerned about suicidal risk, domestic violence, or just some other familial crisis, they can call this crisis line, and it's available 24/7. And the operator can refer them to more help, or they can just honestly be an ear to just let that person vent a little bit. Um, and then another is a guide for family and friends. This I found on the National Center for PTSD, and I gave you all the link. This guide contains content like um, learning about PTSD and just being able to take care of yourself and communicate with the loved veteran. Um, Things like that. And for families who are busy or they can't attend group therapy or family therapy, they can download an app called the PTSD Family Coach app. The link is also there. And this app gives info about PTSD, tips for the family to better support their loved one, facts about counseling, and other tools and tips to help the family member manage stress associated with um, just dealing with the veteran and their new coping mechanisms. Um, Now, nursing. Now, this is very important because in order to properly care for these veterans and prevent or screen for suicidal risk or ideation, it's very important that we are informed. So, firstly, the U.S. Department of Veteran Affairs PTSD website, link is there. This provides databases for assessment of PTSD, facts and questions about the assessment, and screening and referrals. That's mostly for the nurses to just ask those basic questions and really get into the background of those veterans to understand and better assess what they're going through. Um, Lastly, nursing practice implications. Healthcare providers from military and non-military institutions must assume a more active role in early suicide risk detection and prevention intervention. That kind of goes alongside what I was saying in the previous slide. Um, some important nursing implications. It's important to encourage counseling for the family members and provide the appropriate websites and resources for those family members and veterans to access. Oftentimes, they are not aware of the resources that are available to them, and it's important that we inform them about those. And lastly, for the nurses, just to be more informed about PTSD, they can get that information from the U.S. Department of Veteran Affairs PTSD and understand PTSD. This site is very good for providing symptoms, the types of trauma, recognizing PTSD, and just understanding those treatment options. We just want to be more informed about PTSD, the symptoms, coping mechanisms, and resources, because oftentimes families can feel alone or isolated when they are trying to find resources for themselves and for the veterans to cope. And the last slide is my resources. Thank you for listening.